So for both aortic narrowing and for aortic leakage, we often have to do an aortic valve replacement. That typically involves cutting out the patient's own aortic valve and putting in a new valve. In certain patients who are very high risk for that, we can also offer a transcatheter valve option, which involves not removing the valve but putting another valve inside of it. But right now that is really for selected people at really high risk. For the majority of people, we're going to recommend that we do a standard aortic valve replacement with a well-established replacement device. Aortic valve replacement surgery is done really through three types of incisions. Most commonly in the United States, it's done through a full sternotomy incision, which is an incision up and down across the breastbone. The breastbone is divided by a saw, the valve is exposed, removed, and the new valve sewn in, and then everything is wired back together. In some patients, we can do that operation through a half sternotomy incision, usually the upper half, where the incision involves only dividing the top half of the breastbone, and we still have enough access to do the surgery. In some patients, there's an option for doing it even less invasive than that, and that's doing it through an incision on the right side, usually about 3 inches long, maybe less in some patients, and working between the ribs to reach the aortic valve. That's probably the least invasive surgical way to replace the aortic valve.